Billionaires are spending millions to fight the novel coronavirus known as COVID-19. As new cases, deaths, as well as donations are still on the rise. In this video, we will look at the top 5 donations made by billionaires in March 2020. Number 5. George Soros. Former hedge fund manager George Soros pledged $1.1 million to his native Budapest on March 30th. The €1 million gift, which will be paid out through Soros Open Society Foundation, will go to helping Budapest's municipal government provide for the Hungarian capital's elderly and homeless populations during what Soros called an unprecedented emergency, according to a statement emailed to Business Insider. "I was born in Budapest, in the middle of the Great Depression, barely a decade after the Spanish flu left thousands of dead in Budapest," Soros said in a statement. "I lived through World War II, the Arrow Cross rule, and the siege in the city. I remember what it is like to live in extreme circumstances." After leaving Budapest as a teenager, Soros built an $8.3 billion fortune running what was once the world's largest hedge fund. Business Insider reported. Number 4. Giorgio Armani. Fashion designer Giorgio Armani gave $1.43 million to help fight the outbreak in Italy on March 8. The 85-year-old billionaire's gift will go to 2 hospitals and a research institute in Milan and another in Rome. Women's Wear Daily reported. Italy has reported over 10,000 deaths from the coronavirus, more than any other country so far. Business Insider reported. The Lombardy region in the north of the country has been placed on lockdown and public places such as schools, gyms, and museums across the country have been closed until April 3 in an attempt to contain the spread of the virus. Armani built a $6.6 billion fortune from his eponymous fashion house, which also has accessories, cosmetics, real estate, restaurant, and hotel businesses. Forbes reported. Number 3. Ka-Shing. Hong Kong's richest man, Ka-Shing, said he would donate $13 million to help medical workers in Wuhan on February 10. Lee's foundation is also working to source medical supplies for healthcare workers in Wuhan and Hong Kong. Bloomberg reported. Lee plans to make his donation to the Red Cross Society of China, a government-organized non-government organization, Gongo, with no connection to the American Red Cross. According to Bloomberg, Fortune reported that healthcare workers in Wuhan, including at one of the temporary hospitals built in 8 days, reported not having received any help from the Wuhan Red Cross, a subsidiary of the Red Cross of China, despite an outpouring of donations to the group. Number 2. Jack Ma. Alibaba founder Jack Ma pledged $14.5 million to support the development of a coronavirus vaccine. On January 30, China's richest man announced the donation on Chinese Twitter-like platform Weibo. Business Insider reported. 2 Chinese government research organizations will receive $5.8 million of the gift to work on creating a vaccine. According to Axios, "We know that the battle between humanity and disease is a long journey," Ma's foundation said a post on its Weibo account. "This money will help various medical research efforts and help disease prevention." Ma later donated an additional $2.15 million to the Peter Doherty Institute for Infection and Immunity in Australia, to help fund the development of a vaccine. Fox Business reported. Number 1. Bill Gates. Bill and Melinda Gates pledged to donate $100 million through their foundation on February 5 to treat what he's calling a once-in-a-century pathogen. The Gates pledge will be used to support treatment efforts across the globe, build infrastructure to treat patients in Africa and Southern Asia, and fund the development of a vaccine, the couple's foundation said in a press release. They previously pledged to donate $10 million. Bill Gates has long warned that the world is ill-equipped to manage a pandemic. Business Insider's Aria Bendix reported. At the time of his donation, The WHO were yet to conclusively say that the novel coronavirus has reached the level of a pandemic. But Gates disagreed. "I hope it's not that bad. But we should assume it will be until we know otherwise," Gates wrote in an op-ed for the New England Journal of Medicine, February 28. Gates outlined his suggestions for containing the crisis in the essay, including sending highly trained healthcare workers to low- and middle-income countries in Africa and Southern Asia, establishing an international database on information on the outbreak, and funding vaccine manufacturing facilities. Thank you for watching. Subscribe to our channel for more interesting videos.